Hello, I am Dr. Elizabeth Kihika from Alive Medical Services. I'm going to talk to you about antiretroviral medications. I'm going to explain why it is important to take them as prescribed by the doctor and why it's important not to stop them when you've started. So what are antiretroviral medications? Antiretroviral medications, which are sometimes known as ARVs in short, are medications that are taken by people living with HIV in order to suppress the HIV virus in the body. ARVs do not cure HIV. But how do these ARVs work? When someone gets infected with the HIV virus, the virus multiplies and destroys the white blood cells, which are responsible for the person's immune system. Most especially the immune cells known as the CD4 cells. This weakens the body's immune system, making the person a target for many infections as well as diseases. So what ARVs do is to prevent the HIV virus from multiplying and destroying the white blood cells or the CD4 cells. In doing so, the quantity of the virus, also known as the viral load, reduces to close to an undetectable level. Remember, ARVs do not cure HIV. So when does one begin to take their ARVs? Basing on CD4 count, our current guidelines recommend that anyone with a CD4 count below 500 per mil should be started on ARVs. The World Health Organization, however, is currently recommending to test and treat anyone who has tested positive for HIV. Presence of certain diseases like tuberculosis, meningitis, hepatitis B are also conditions that make someone eligible to start ARVs. All pregnant and breastfeeding mothers are also recommended to start ARVs in order to prevent transmission of the virus to their unborn baby or to their breastfeeding child. All children below the age of 15 years of age are also to be started on ARVs upon being tested and found to be HIV positive. All positive partners to discordant couples are also recommended to be started on antiretroviral medications. Most at-risk populations, for example, men who have sex with men, commercial sex workers, fishermen, long track distance drivers, among others, are also recommended to be started on ARVs upon testing. So how should antiretroviral medications or ARVs be taken? ARVs are of different kinds and of different classes. So it is very important for you to understand how to take it, when to take it, and what to expect when you take it. Some medications are taken once a day, others are taken twice a day. Some are taken only at night before you sleep. Others are taken only on an empty stomach, while others are taken after you've eaten your food. Don't worry. This information is provided by your counselor, your doctor, or your pharmacist. Remember, it is very important for you to understand the instructions as to how you're to take your antiretroviral medications. If in doubt, do not hesitate to ask your doctor, your counselor, or your pharmacist. Thank you. Once again, I am Dr. Elizabeth Kihika from Alive Medical Services.